Hello, I'm Dr. Inman. I'm the frequency-specific low-level laser guy. Been at it for the last 20 years. We spent a lot of time developing techniques and methodologies and protocols for the use of a number of different lasers. Currently, we're using this one because it's the most effective, by far, 10 times more effective than any ones we've ever used. We've had a number of people that are interested in it. It's about 1/3 the cost of the lasers we used to use, which is nice and lasts kind of forever, and it has about 1,800 different protocols. But every once in a while, people will comment about they'd like this laser now because they've had the previous lasers, but their significant other suggested that maybe this is not a purchase for them to make right now. However, when they mention to them that this one carries the human facelift protocol, that gets their interest essentially, and that sometimes makes the sale, so to speak, or in other words, people will order it then. And so a lot of questions have been asked about the facelift advanced human protocol essentially, and I'll comment about that right now. Of course, we don't lift the faces of dogs, cats, and horses, although a lot of our research that was done on domestic animals essentially. The human being is interesting because the skin of the face is attached to the musculature of the face, and this is kind of important. And also what's important is the human female has a thin skin compared to the human male that has a thick skin, essentially. Now, over a period of time, the musculature, the tonus of the muscles of the face basically decrease in their activity. They go from 100% down to about 60 to 50%. And what occurs is you have a sagging of the musculature. When in the human female particularly there's a sagging of that musculature, essentially what occurs is we end up with the face dropping or drooping down. The eyes come down essentially and hood, and the face in this area basically comes down and puts wrinkles aside the eyes and also parentheses lines in the human female, and waddles right here at this area. Now, I've had a good experience with a friend of mine who's a plastic surgeon, and the surgery that's involved for human plastic surgery essentially to take care of facelift is to come in and take a bunch of tissue out of the sides of the musculature here, taking out the laxity of those muscles and pulling it up like that, and then taking it up here and pulling it up like this. And so this is the effect of a good facelift. It goes from here to here, okay, without being like this, okay? And so that's essentially what a facelift does. A facelift is, like all surgeries, it's an attempt to try to perform a mechanical or architectural change in the body to ameliorate or reduce a clinical symptom or sign or symptomology. But what we really want to do is we want to put the tonus back into the musculature, and so we do that with the facelift protocol essentially. And we can go from about 60%, which gives you this, to about 85 to 95%, which brings you up like this. And what we're looking for is probably about a 1 centimeter increase in the here. We remove these and remove these to some degree, and so it goes like this. This is the response that we get, and usually anywhere from 10 to 13 laserings over a period of about 3 weeks to 3 months essentially is required for us to get that kind of response. It's important to understand that when we use the facelift protocol, we use these on the face. We set the instrument, see if I can get it to work, and we're moving it around the sides of the face. Okay, we're trying to avoid the area of the eyes. We're at about 225 to 375 milliwatts essentially, avoiding the eye and the retina. We want to make sure that the client has their eyes shut and they have this protection over their eyes. And this is the effect right here. This is the technology that we use, and it isn't any more complicated than that for about 60 seconds. For those of you who have interest in this approach, please feel free to contact me at drbill at vomtech.com, or you can call me area code 208-640-3430, 208-640-3430. That's my cell phone, Pacific time. You can also email me, and I'll be more than happy to give you more information on this instrument. Of course, this device was designed to treat domestic animals and the human mammal too, and then it's just kind of interesting that we're able to get this response, the facelift protocol essentially. There are 2 other facelift protocols in this product programming, and if you contact me, I can give you more information on that if you have interest. So thank you very much for your patience, and have a great day.